Good morning, everyone. We're going to get started. Good morning.
Good morning.
Welcome to the 2026 Shape of the Region Conference. I'm Harry Klaff, U.S. President for Avison Young and Board Chair of the Community Foundation for Northern Virginia. This marks the 9th annual conference hosted by the Community Foundation for Northern Virginia, where business leaders, innovators, and change makers come together to explore bold ideas and practical solutions that will define our region's future. Northern Virginia has never lacked talent, ideas, or ambition. What this moment asks of us is something different: coordination, creativity, and courage to act across all sectors. Today isn't about admiring the challenges ahead, it's about understanding them and deciding how we respond together. As chair of the Community Foundation for Northern Virginia, I've seen firsthand how this organization serves as a broad-based funder, a trusted advisor for charitable investments, and a convener tackling our region's most pressing issues. Our vision is to build a Northern Virginia that works for everyone. With over 200 funding partners, over $100 million in managed philanthropy assets, and $10 million in annual grants and scholarships, we are serving as a catalyst to make this happen. I'd like to start by asking my fellow board members, current and past, to stand and be recognized for your volunteerism and support. Thank you, my friends. I appreciate all of your work. This year, we're pleased to bring you stories of hope and innovation on some of the deepest issues impacting the infrastructure of our region and our lives each and every day. We hope that you will each come away with some actionable insights, that each of us can have one more idea or a tool in our toolbox to help make Northern Virginia a better place to call home. This conference reflects the same spirit behind the Inova Roadmap, a project of the Northern Virginia Chamber, which recognizes Northern Virginia's most complex challenges that are best addressed with anchor institutions aligning around a shared vision that act together. I think Julie Coons is in the audience from Northern Virginia Chamber. If you could stand up, be recognized for the Inova Roadmap. Thank you, Julie. I am now pleased to get this show on the road, and I'm pleased to welcome up to the stage Drew Wilder, NBC4 Northern Virginia reporter and today's event host.
All right, good morning, everybody. Thank you, Harry. Also want to thank the team at Vallow Park for hosting us this morning. This has become the spot for conferences. This is such a fantastic room. It's such a great space. I hope you guys enjoy being here as much as I've been enjoying coming here to these events over the last few years. It's a good space for this type of event and should be a good program, again, as always this morning. My name is Drew Wilder. I am a Northern Virginia reporter for NBC4. I cover all of the news and events here in Northern Virginia, so I am always honored to take part in this particular event because this gets at the core of what I do for work, the community that I'm raising my family in, and the community that we are all working to build and grow in together. This is my 5th year being here for the Shape of the Region Conference, so I'm really, thank you. Thank you for having me back. I love this event because we're addressing some issues, but we're not satisfied in this room just talking about problems or the bumps in the road over the last 12 to 16 to 18 months and the next 24 months. We're looking at issues and the ways that we can solve them together, collectively. And that's what makes this conference so special, is not just addressing problems, but looking at potential solutions and how we can work together to maybe get to some of those solutions. This year's event is called Innovation and Leadership for Northern Virginia. What does a thriving Northern Virginia look like, and how do we get there? How do we get there together? This year's conference centers on the interconnected systems that define community well-being, from health, housing, transportation, also arts, education, economic opportunity, and how collaboration across sectors can strengthen resilience and drive shared progress. Northern Virginia is, as we all know, one of the most dynamic regions in the country, but momentum is not guaranteed, and we've certainly seen that over the last 12 months. Economic uncertainty, rapid technological change, growing pressure on housing, education, healthcare, infrastructure, testing our resilience in this region. So today, again, about looking forward, not reacting, but examining how this region prepares for what's next. Before we begin, please join me in thanking the 2026 Shape of the Region sponsors who have made today's event possible, including our engagement sponsors, the American Psychiatric Association Foundation, Avison Young, Business Benefits Group, George Mason University's Costello College of Business, Inova, Robert and Pamela Kipps, McGuire Woods, McCann-Lish Lillard, and We Rock the Spectrum. A round of applause for our engagement sponsors. And next, a thank you to our champion sponsors, and Wen State Farm, Bank of America, Credence Management Solutions, Northern Virginia Association of Realtors, Northern Virginia Technology Council, and the Potomac Health Foundation. Thank you. And this year's media partners, Inside Nova, KME Digital, and We're Good Podcast. Thank you to the media partners. And we are also grateful to our regional partners who have invited your networks to join us in today's important discussion, now shown on the screen. Thank you to all of the partners that make this event possible every single year. These partners represent all sectors of the Northern Virginia region: business, philanthropy, education, government, highlighting how our region's strength comes from collaborations and those intersections of the work across all sectors. You will see a QR code. It's both in your program and it's up on the screen right now. If you take the snapshot of that and use that QR, there was a digital program in there. It'll include some bios about our speakers, information about the sponsors, and a lot more information. Really excited for today's event. A little bit different this year. We've got our keynote, but we're also going to be presenting some lightning talks. These are designed to be fast, focused, forward-looking, and they offer a snapshot into a lot of different areas that we're talking about this year. A snapshot of where we are, a glimpse of what's possible, and a challenge to all of us in the room. Our speakers represent influence and action, people shaping outcomes, not just ideas. The goal is an agreement. It's alignment around shared priorities and looking at next steps together. Progress happens when decision makers listen to perspectives beyond their own lane. To help set the stage for these lively presentations, I am pleased to welcome this morning's keynote speaker, Paul Misener, native Northern Virginian and former 23-year Amazon Global Vice President. Good morning, Paul. Thank you. His perspective sits at the intersection. I jumped the gun on that. I cued your clap and you responded well. Thank you. A few more sentences and we'll try that again on cue. Paul's perspective sits at the intersection of technology, policy, leadership, and culture, exactly where regional resilience is built. His message challenges us to think bigger about how innovation can serve people, communities, not just markets. Please welcome Paul.
Well done, Drew. It's not often that I get two introductions. But thanks very much, Drew. And Renee, thank you for inviting me, and Julie, thank you for suggesting me. I appreciate that very much. 63 years ago, in early 1963, I was born in Alexandria Hospital. It's about 10 miles from here as the crow flies. Woo, Alexandria, good. Yay, okay, good. These are the birthers. So as long as I can remember, I've been a proud Northern Virginian. Now, being born in early 1963 in Northern Virginia to a solidly middle-class family, I hit the jackpot in the lottery of birth. Do you know this thing, the lottery of birth? You ever heard of this, some of you? Yeah? Well, the gist of it is it's an observation that one's trajectory in life relies heavily on where you were born, when you were born, and to whom you were born. Now, consider my circumstance. I mean, if I had been born in early 1963 to a solidly middle-class family in Tehran, my life would have been considerably different. Instead of spending my 16th birthday here in Northern Virginia getting my driver's license, I would have been 16 at the culmination of the Iranian Revolution in early 1979. That would have been different. What if instead I had been born in Northern Virginia to a solidly middle-class family, not in 1963, but in 1863? I would have found myself right in the middle, literally, of the American Civil War, both in time and in geography, right in the middle, north and south. Very different. And what, of course, if I had been born here in 1963 to impoverished parents, things would have turned out much differently, I'm sure. Well, you'll notice something about this lottery of birth, the where you were born, when you were born, to whom you were born. I had nothing to do with those things. Nothing. Absolutely nothing. And so anything that has fallen out of the fact that I was luckily born to in Northern Virginia in '63 and to middle-class parents, the luck that went along with that, I cannot be proud of that. I cannot take pride in that because I had nothing to do with it. There were literally billions of people that have been born since me, and they didn't have the same circumstances. So how can I possibly be proud of where I was born? It had nothing to do with it. Okay, well, something else happened in 1963. A band, you may have heard of them, they were called the Beach Boys. A couple of you have heard of them. And yes, we're all over 40. The Beach Boys released a song which, in my view, is the most vacuous, vapid, shallow song they ever wrote, which is saying something for the Beach Boys. I mean, they made a fortune singing about automobile engines, surfboards, and Santa Claus. But this song, you may have heard of it. It's called Be True to Your School. Heard of it? Something? A couple of you have heard of it. But one of the lines in the song says, be true to your school now as you would to your girl or guy. Well, this is problematic on many levels, but one of which is that the Beach Boys are telling you to treat your friendship or perhaps love relationship as you would treat how you think about your school. Hey, honey, I really love you just as much as my school. So it's a problem. But there's also a bigger problem with this song. The Beach Boys, a band out in California, they're telling teenagers, and I think we can agree that these are American teenagers in public schools. That's the audience for the Beach Boys. They're telling these teenagers to be true to their school, but yet they don't know these teenagers. How could they? There are many of them, millions of them. They don't know the teenagers, and they don't know the schools. I mean, what if a teenager is going to a school which is physically dangerous? The teachers are lazy. The principal is a drunk. Do you be true to that school? No. And remember, of course, why these teenagers are at the school they're at. It's because, well, they live in the district. So, there's some guy, teenager, whose mom rents an apartment about a half a mile from the school. That's why he's in that school, just because he lives there. That's not reason to be proud. Well, do you remember Oprah's microphone? Oprah's microphone about yay big, and she would hold it, and she would talk to the audience, she would talk to the guests. She occasionally would walk down into the audience with the microphone and ask a question and get an answer from an audience member. Well, let's say I had an Oprah microphone with me here today. Maybe I borrowed it from the Smithsonian. There's one of hers actually in the Smithsonian. But I've borrowed it, and I have it here today. I could walk up and down the aisles here and then across the rows and ask every single one of you a single question. There are 300 of us roughly in this room. Ask every one of you the same question. Are you proud to be an American? Yes or no? It's not a hard question, not a trick question. I'm guessing that the vast majority of us in this room, if not all of us, would say, well, yeah, yes, USA, USA. Okay, but why? Why are we proud to be Americans? Is it because we live here? I'm guessing the entire audience lives in America, as I do. Is it because we were born here? Probably, if statistics hold, about 85% of this audience here was born in America, including myself, as you know. But isn't that just be true to your school? You are in this country, you live here, you're in the district. Be true to your school because we're just here, we live here, is that it? Or is it because we were born here? Isn't that the lottery of birth? We can't be proud of where we were born. We had nothing to do with it. Well, what if the country does something that you're ashamed of? What if it does something that you would condemn if another country did it? Well, this is not a political speech. I'll spare you that. But the point is this, that the lottery of birth, be true to your school, and sort of subconscious patriotism, sort of assumed patriotism, give us a lens through which we can all view the shape of our region. That's the purpose for raising all that. Now, I believe, as I told you before, that I've been a proud Northern Virginian for as long as I can remember, over half a century, which is a little scary. But why am I a proud Northern Virginian? Is it because I was born here? Well, I'm probably in a minority here. I'm guessing that roughly, I don't know this for sure, about roughly a quarter of us in this room were born in Northern Virginia, roughly. So it's not even a majority of us, but is that reason in any case? Or is that just the lottery of birth? How about we live here? Well, I'm guessing virtually all of us, if not all of us, live in Northern Virginia. Is that sufficient reason? Or is that just be true to your school? Look, I think if we're going to be proud of Northern Virginia now or into the future, we have to have good reasons for being proud of Northern Virginia. Now, I think we do have good reasons. That's sort of the good news here. We can start with the reports from our leading business associations in Northern Virginia, the Northern Virginia Chamber, the Northern Virginia Technology Council. Each, within the past 18 months, has put out a report about the state of things, the shape of things in Northern Virginia. If I can summarize these two reports, business is good. Now, as a business person myself, that makes me happy. I'm happy that business is good in Northern Virginia. We talk about the ecosystem here. We talk about growth. We talk about the technology, the brand name companies that are all here. So that's good. That makes me happy. But I don't think it's sufficient to make me proud. Something else must be here besides business is good. Well, things are here. There are reasons we can be proud of Northern Virginia. Let's add some up. First, Inova, the leading healthcare system in the region. And Dr. Sharma practices medicine there. Dr. Narang, I don't know if you're here, Steve, but he also does. Inova allows or provides patients emergency, primary, and some specialized care without considering their ability to pay. That's worthy of being proud about. Metro is much maligned, but I think I've ridden subway and light rail systems in something like 30 different cities all over the world, maybe more. And Metro ranks right up there with them. We can be proud. It's safe, it's reliable, it's too expensive, but that's a matter of politics because I think, frankly, we should subsidize it even more so it's nearly free. But that aside, it's a good system. We can be proud of that. Our electricity is very reliable. Our tap water is drinkable. It's actually kind of good. The internet is famously plentiful. If you land on any of the 3 runways 19 at Dulles, just look out the window. That's the internet right there. We also have some of the best public schools in the entire country. These are schools worthy of being true to. We have them right here. We should be proud of that. And last but not least, we have charitable organizations in Northern Virginia that are excellent, absolutely excellent. We'll talk a little bit more about them in a bit. So we have reasons to be proud. Now, the real question is, will we have reasons in the future? Will we have reasons 2 years, 5 years, 10 years from now? And I don't know. We have challenges. So the business associations, the community associations, the community foundation itself have put out papers outlining some of the challenges that we faced. And they're not trivial. They're also not insurmountable. We just have to do it. We have to do it. So we're going to hear from Dr. Sturtevant in a little bit here. She's an actual housing expert, and I am not a housing expert. But you don't need to be an expert to recognize that housing in Northern Virginia is not affordable. It's not affordable at a lot of different levels. Young professionals, impoverished people, everything in between. It's a real challenge. And now, some of the business groups have put out some solutions for these. One is government zoning. One is government permitting. One is government subsidies and enticements for workers to move here. One is government process and procedure. Do you hear something in common there? It's relying on the government to do things. I don't mean to be a pessimist, but that's not a recipe for quick action. It's not a days, weeks, months thing. It's a years thing. And in the interim, people have challenges affording housing. If your family of four is making $50,000 in Northern Virginia, half of it goes to rent. Half. How is that sustainable? It's not, of course. All is not lost here, however. We do have opportunities to overcome such challenges, and there are other ones that go along with this. A lot of them are quite related. The people that have housing affordability challenges often are the ones that have food insecurity problems. They go hand in hand. So we have circumstances in Northern Virginia that are not pristine. I said, and I believe, that we have right to be proud of Northern Virginia now, but if we don't take care or address these problems in the next decade, I don't think we have right to be proud in 2036. When Renee calls us back here in 2036, we must have done something to address these challenges. We can't have just stagnated and just done what we're doing and, oh, business is good in 2036. You know, that's not sufficient for business to be good in 2036. Now, there is some good news here. We have some opportunities that perhaps don't exist in other regions. And I think you may be surprised at the opportunity that I'm going to suggest here, because it's usually condemned, this notion. But let me start out here with an example. Let's all get in an airplane, and we're going to fly to Southern California. All of us are. And I'm going to take you on a little tour, and we're going to go to Hollywood. And in particular, we're going to Hollywood Hills. And I'm going to point out some landmarks in Hollywood Hills. That guy up there in that house, he's worth $25 million. Well, she over here, up on that hill, she's worth $150 million. She's worth 6 times more than this guy. If this guy falls on hard times, she can help him. She's worth 6 times as much as this guy's worth. Does she help him? No. He's rich. No one's going to provide charity to somebody who's worth $25 million. It's not going to happen, even though she clearly could afford it. Okay, back to the airport. Let's take off again. We're going to go to, on an overseas flight, we're going to South Sudan. And I'm going to take you on a tour. It's flat. We can walk. And I'm going to walk over here, and I say, okay, that guy right there, he lives on $3 a day. Now, if you don't know this already, roughly 1/10 of the world's population lives on $3 a day or less. That's somewhere between 500 million and 800 million people live on that at that sort of poverty. Okay, well, we come over here, and I say, she's living on $6 a day. She has twice as much to spend than this guy. Should she help him? Will she help him? No, she won't. Why? Because she's just barely making it, just barely staying alive. And we're talking, again, something like 1/10 of our fellow humans in the world are living at this kind of level. But she's not going to help out this fellow human who only has about half the wherewithal that she has. Why? She's just barely making it. So charity does not work in Hollywood Hills or South Sudan. It doesn't. Wealth inequality in the United States is a real problem. I was in Finland last month and spent some time there. In Finland, they've figured it out such that wealth inequality isn't a thing. It really isn't. There's no real high end, there's no real low end. It's all right about here, and it works. There are a lot of reasons, policy reasons, cultural reasons, that it works, but it doesn't work in the United States. We have tremendous wealth inequality. In Northern Virginia, we have it in spades, this wealth inequality. If you don't believe me, find a couple hours some afternoon this week, get in your car and drive to Oakton, Vienna, McLean, Great Falls. Then drive down the Beltway, stop at Bailey's Crossroads, go down to the Route 1 corridor, go to Hybla Valley, go to Fort Belvoir, and see what you see. You don't even have to get out of your car. The wealth disparity, this is one county. This is all in Fairfax County has this level of wealth disparity. It's a terrible thing. We need to fix it. Back when I was growing up in the 70s, 1978, the top marginal federal income tax level was 70%. Now, Ronald Reagan ran on a platform of reducing that tax rate, and I tend to think he was right to do that. The problem is we've never stopped reducing it. It didn't go from 70 to 55%. It went from 70 all the way to, what is it now, 37%? Well, of course we're going to preserve wealth inequality if that's the kind of taxation system we have. Now, I don't have the right number here. I'm not making policy here. I'm just observing that this wealth inequality exists. It's a terrible thing. We need to address it. But while we still have it, including especially in our region, let's use it to advantage for charity. For private regional charity, we can do it. We can do it in a way that they can't do it in Hollywood Hills. That doesn't work. Can't do it in South Sudan. That works. Here in Northern Virginia, it can work. We have the real demand for charity. We have the potential supply for it in spades. Private regional charity. I think this is something that we need to avail ourselves of. We have to do it, though, and we can't just sort of rely on status quo to get us there. Now, I actually Googled something a couple weeks ago. I Googled charitable organizations. I kind of wanted to get a sense of how many there are and what there are. Well, I came across a Forbes article from last autumn, which described 34 different kinds of charity in America. Okay, charitable organizations, 34 of them. I can't remember 34. I certainly can't understand all 34. So for you, I have narrowed it down to 3. Yeah, you're welcome. And this is your lucky day. But before I get to talk about charitable organizations, what about just one-on-one charity? What about sharing with our neighbors in Northern Virginia? We could do it. We could go to our ATM, take out, I don't know, $200 and $20 bills. So we got 10 of them. Let's go down to Hybla Valley and walk up to someone and say, hey, are you in need? And he says, yeah, I'm in need. Things are bad. And I say, okay, here's a 20. Cool. He kind of looks at me weird, but he's happy. And I do this 9 more times. I can do this. We can do this without any middlemen. There's no overhead in doing this. We don't need organizations to organize me to go and hand out some 20s. But this is not scalable, obviously, nor is this intelligent charity. This is just giving it away to somebody I happen to see on the street. I don't know if these are the most needy people in the area. That somebody might be homebound just down the block, and they're terrible. They're not well off at all. And I didn't give any money to her because I was giving it out just to the people I happen to see. It doesn't scale, and it's not smart. This is where charitable organizations come in. You know, I'm a business person, worked for some very large companies over the years, and imagine a circumstance where if you're sitting in there around a boardroom table, and there's like 6 of you, whatever, and you're talking, and someone says, hey, look, we have a couple big challenges and a couple big opportunities related to this one subject matter. Do you know anything about this subject? Do you? No, I don't. Sorry, that's not. Oh, but I know Gwen down the hall. She's an expert in this, I'm pretty sure. Let's go talk. So we all, go down to Gwen's office, knock on the door, and say, hey, we've got this great challenge that we need to face. We've got a great opportunity that we ought to take up. It's on this subject. We think you know something about it. It's this. And she says, yeah, I know it. Yes, of course I know this, but I have 19 other projects. I can't do it. Then we sort of sheepishly walk away and say, thank you for your hard work. We were great, thank you. Then we go back to the conference room. We sit around the table again and say, wow, well, she was the only one who could have done it in our company. I guess we just won't take this opportunity. We won't face this challenge. No, that's never what happens. That is not how it works. What happens is you go back to the conference room and you say, we're going to call PwC and Deloitte and McKinsey and we're going to get this done. You hire consultants when you don't have the expertise in-house. You hire them and you pay them handsomely. Well, that's what it's like to work with a charitable organization. They're experts. They can help you do good because you don't know how to do good in the way they do. They don't know how to reach the needy. We don't know how to reach the needy people. They know. That's their business. And we pay them for it. It's called overhead. Now, some charities have received a bad name, justifiably, for ridiculous overhead. Some have like 95% overhead. That's not a charity. That's a fraud. And why government agencies or class action attorneys don't go after that is beyond me. But the point is this, that you're perfectly willing to pay PwC and Deloitte for expertise. You ought to be willing to pay a charitable organization for their expertise. Otherwise, you're handing out 20s on the street. So there are levels of expertise. And here I'll give you the three, by the way, the three different charitable organizations. I narrowed it down to roughly 10% of what Forbes said. One is a single-threaded, single-focused organization. Does one thing, does it presumably very well. That's exactly what they do. The advantage is they can become experts, perhaps even unique experts in that particular field. And from a donor's perspective, you can give to it knowing full well where your money is going. It's not going to a bunch of random places. It's going to a very specific organization. Here in Northern Virginia, one that I have supported over the years is the foundation. It's called the Partnership Fund for Thomas Jefferson High School for Science and Technology. It was a passion of mine. I served on their foundation board for 7 years, 3 of which I chaired, and it's a great organization. It does exactly one thing. It supports the educational programs of that STEM high school, and I commend it to you. It's worthy of your consideration. The next kind of organization that I see, charitable organization, are ones that are multifunction. They do a bunch of different things within their own management umbrella. And the quintessential example here in Northern Virginia is Northern Virginia Family Services. They provide 11 different kinds of services to their clients, the needy people in Northern Virginia. And one key advantage of an organization like NVFS is that they can take a holistic approach to the needy person, the charitable, the person in need of charity, the family in need of charity. They can go in and see, well, early childhood education is a problem here. We can help out with that. And then you can notice that perhaps the parents are unemployed, and you say, oh, well, maybe some job training works here too. And oh gosh, the kids are hungry, so food insecurity. Anyway, I commend NVFS to you. I know that Stephanie and Kathleen and Ann are here somewhere. Talk to them. Woo. I can't say I get that every day, but it's worthy of your consideration. And the third kind of organization here is the quintessential one is the Community Foundation for Northern Virginia. They serve as, in my small brain business perspective, they serve as a charity of charities. And so rather than have a bunch of different functions within a single organization management structure, it's more like these are individual separate kinds of specialties within an umbrella that now is served by the foundation. And Renee does terrific work. Thank you for this. And thank you also for bringing us together. It's worthy. Now, that's the sort of the demand side. On the supply side, let me suggest to you that if you don't already have one, you set up a mechanism for charitable giving. And this goes both for you as an individual and family and for the companies that you work for. I did this about 15 years ago, a little bit longer perhaps. I set up what is called a donor-advised fund. And I know there are experts on this in this room. And so, in fact, Emily Harper and Jessica Gibbs are in here somewhere. Good, yay team. Talk to them about a donor-advised fund. So they actually are experts. They're at Monument Wealth. And so it's worthy of a conversation. But the gist of a donor-advised fund is an individual or a company can set up such a thing, and it basically is a separate bank account. I'll think of it that way. And you put money into it. The tax advantage is that same tax year, you can take an income tax deduction on your contributions to it, even before you decide or advise where the money should go ultimately. And then the mechanics of actually making contributions to different organizations, it's handled by the fund, the sponsoring organization of the fund. I happen to have done it through a commercial banking company. For me, it's Raymond James, but you can also do it through CF Nova, for example. You can establish essentially a fund internal to their structure, and it has the same kind of functionality. But again, you need experts. Talk to Emily and Jessica. So I'm going to wind down here in a second with a thought about our future here in Northern Virginia. I've given you reasons why I think we can be proud of the region right now. And I feel strongly about that. And as I said, half a century I've been a proud Northern Virginian. I'm going to be disappointed, however, if in 2036 we can't look back and say we've addressed the problems that we knew about in 2026. The ones that are unforeseeable, or unforeseen at least, we can't be blamed if we're not on top of those immediately. But we know the problems right now in 2026. If we can't fix or at least substantially address these things in the next 10 years, then shame on us. We can't have reason to be proud if we don't do it. If we get to 2036 and all we're saying is business is good, that's not good enough for pride. But I think I've tried to articulate there are ways in which we can address these problems. We have the means in this region that don't exist in South Sudan. We have the reason to do it in this region that don't exist in Hollywood Hills. We ought to be able to take this on. Really, it's not going to be that hard. We just have to do it. It's very much a Bo Jackson kind of a moment where we know we need to do it, so just do it, all of us. So I hope that you will join me in ensuring that 10 years from now we can reconvene and remain proud of our region. Thank you very much. Thank you, Joe.
That was fantastic. Paul, thank you so much. And that's exactly the tone, right? We know we've got road bumps, we know we've got challenges, and we know how to get there together. And now we're going to launch into our lightning talks and further that conversation. This is going to be our first lightning talk speaker, Dr. Lisa Sturtevant. Dr. Sturtevant is the chief economist for Bright MLS. She leads the organization's research and forecasting efforts, providing market insights for more than 100,000 subscribers across the Mid-Atlantic. Please join me in welcoming her to the stage to talk about housing. Lisa.
Okay, can everyone hear me? Good morning, everyone. Lisa, I'm really glad to be here today. I have 5 minutes to talk about housing, and this is such a great place to start. I love talking about housing because everybody has a housing story. Everybody has rented an apartment, everyone has bought a home, or everyone has a family home that they remember. Housing is important to everybody. And this is the housing situation right here in Northern Virginia. You need $200,000 to qualify to purchase the median-priced home here in Northern Virginia. You need $100,000 of income in order to afford the median rent here in Northern Virginia. You can see on the slide here the share of our renters, our homeowners, including those who own their home outright, who face cost burden, right? This is the folks who spend more than 30% of their income, or maybe 50%, the severely cost burden, of their income on housing every single month. And when you have less to spend, when you are spending more than 30% of income on housing every single month, you have less to spend for other important things, for healthcare, for transportation, for education, for things you want to do for your family, for self-improvement. And you can't make those investments in yourself and in your family if you're spending more than 30% of your income on housing. Let me put this in perspective. You need $100,000 to afford the median rent here in Northern Virginia. The average wage of an elementary school teacher in Northern Virginia is $74,000. The average wage of a city bus driver in Northern Virginia is $64,000. The average wage of a home health worker is $37,000 in Northern Virginia. These are the people that you meet every day. I like to think about it that way, right? Think about getting up in the morning and the folks that you meet as you go out on your day. Maybe you drop your child off at childcare. Where does that childcare worker live? Maybe you hop on the bus to go to work and you say, where does that bus driver live? Maybe you stop at Starbucks or a coffee shop and you ask yourself, where does that barista live? And you drop off your dry cleaner. Where does that dry cleaner live? These are the people that we encounter every single day. Or maybe you go home and you're taking care of your elderly mother or father, and you're wondering, where are they going to live on a fixed income in our community? Or maybe you have adult children who have just finished college, and you're wondering, can they live in the neighborhood in which they grew up? And the answer is probably no if they're trying to come back to Northern Virginia. So this is the situation that we find ourselves in. But the thing that I think is so exciting about having housing be the kickoff to this particular lightning round is housing serves as a platform to all sorts of other good things for individuals, families, and communities. We know from the research that people who have access to stable, affordable, and accessible housing have better mental health outcomes, they have better physical health outcomes, and they have better family dynamics when they're not worried about making rent. I think about this in terms of mental well-being. Imagine if at the end of every single month, you were worried about whether you were going to be able to make your rent payment. Can you imagine the stress? I mean, I stress out when I didn't do the laundry over the weekend and I don't know what I'm going to wear on a Monday morning. Imagine the stress of having to worry about whether you're going to have a place to live. We also know that access to stable, affordable, and accessible housing is good for educational outcomes. When children don't have to move frequently, they do better in school. But here's the kicker. Even middle-class and upper-middle-class families in those schools where children have to move less frequently are also seeing better outcomes. Your child does better if all children do better, is what the research finds. And then finally, on economic mobility, we find that when people have access to stable, affordable, and accessible housing, they can invest in themselves, they can move up the economic ladder. And oh, by the way, our local economies do better when there is housing affordable to people all along the income spectrum. We know that. The research shows that, and increasingly, our local economic development folks in Northern Virginia, to our pride, I think, have included housing as components of economic development strategies for the first time in a long, long time. And that's really important. So what I'm going to talk about just very in my last minute here is, I will say, we don't need any more research, which is hard for a researcher to say. We know what needs to be done. There is no solution we haven't discovered. What we need is to build political will. And I'm going to argue that we need to think about how we talk about housing to build broader consensus, not only in this room, but in the rooms that we find ourselves in. And I'm going to talk about it in terms of the 4 C's. Compassion. For some people, housing is a basic human right. Everybody deserves housing. Many of you are in this room. But that's not true for everyone. For others, it's about consequences. Tell me what happens to our individuals, our families, our communities. Show me the research about what happens when we don't have access to stable, affordable, and accessible housing. For others, it's continuity. Talk to me, talk to people about what happens when their family members can't come back to live in the place they grew up. That's going to resonate. And then finally, for others, it's all going to be about commerce. Talk about what happens when our region, our great Northern Virginia region, doesn't have enough housing all along the income spectrum. What happens to the businesses? What happens to the economic vitality? And what happens to the community, what we want to build if there isn't accessible, affordable, and stable housing. That's my lightning talk. I'm going to turn it over to Drew for our next speaker.
Thank you, Lisa. That was excellent. The urgency has me captured, too. I loved it. All right, we're going to keep the lightning talks moving forward. As soon as I get my page here. We want to welcome to the stage now our next lightning talk speaker, Dr. Garima Sharma. Dr. Sharma is the Martha Shar Endowed Chair in the Women's Cardiovascular Health and Director of Preventative Cardiology and Cardio-Obstetrics at Inova Health System. An international leader in women's cardiovascular health, she previously served on the faculty at Johns Hopkins, where she founded the Cardio-Obstetrics program. Please join me in welcoming her to the stage to talk about healthcare.
Good morning. This is amazing to be here, and thank you for inviting me. We've heard amazing talks so far, and it's wonderful to follow these talks. But we're going to pivot a little bit. We heard about income inequality, we heard about housing, and much of my talk today is going to be on health, the truest form of wealth. It is the only and the truest form of wealth. As a cardiologist, we take great pride in making wonderful strides in healthcare. We can prevent a person from dying. We can transplant their hearts. We can operate on babies that are 24 hours old and fix congenital defects. We can predict genetic causes of diseases. We can tell you your personalized risk of heart disease. And yet, I stand here before you acknowledging that cardiovascular disease is the single leading cause of death in the US. It has continued to be this for the last 50 years and will continue to be that for the next 50 years if we don't take account of what's happening to us. The average life expectancy of a US male is 76 years. An average life expectancy of a US female is 79. And by the time we get there, we're going to accrue risk factors which are going to increase our morbidity, the ability to engage with our family members, to be able to go out for walks, to be able to breathe air. These are hypertension, diabetes, obesity, high cholesterol are the major four. And this is what Virginia looks like right now. So this is a heat map from CDC that tells us what's killing Virginians. Cardiovascular disease, number one cause. What's killing Virginian females? Cardiovascular disease, not breast cancer. And last year, in 2024, 17,000 Northern Virginians died of cardiovascular disease. Just think about that number. And just a show of hands in this audience, how many of you have lost members of your family with heart disease or have members of your family with heart disease? Look around. It's everyone. And that's the problem. And if we don't take account for this, it's just going to continue to grow. How about women? I take care of women. I specialize in heart disease care for women. That's what I've dedicated my life and my profession to doing. And that number isn't looking very good. I was a co-author of a paper in a flagship journal for the American Heart Association called Circulation. This came out February 2026. And very, very proud to be a part of this, but also very deeply humbling because the forecast for cardiovascular disease in the US does not look good. It is going to increase. 6 out of 10 women in 2050 will die of heart disease. And this is all heart disease. Stroke, heart failure, atrial fibrillation. The percentages of hypertension will increase. Diabetes will increase. And this is all age groups. So whether you slice it or dice it in different ways, midlife women, ages 40 to 50 to 60, 55 years of age are going to be the predominant people that get impacted by this. So these are not great numbers. We've often battled with the fact whether heart disease is the same in women or men. And the questions that we've asked in the last few decades about research and how do you care for patients, how do you care for women, how do you make that an important part of healthcare. Cardiac disease in women is under-recognized, it's undertreated. Our clinical trials don't include 50% women, and women are not small men. Women's biology is different. We are very different. Biologically, at a cellular level, we're different. And cardiac disease in women accrues through different life stages. During birthing stages, gestational hypertension, diabetes, preeclampsia, preterm birth, menopause, menopausal transition, ovarian failure, depression, rheumatoid arthritis, lupus predominantly affects women as compared to men. So having a very personalized risk prediction that takes care of women through the lens of not if sex matters, but how does sex matter is important. And I'm very proud to be a part of an institution that has a very specialized service line for caring for women with heart disease. The future is in our hands. Cardiovascular disease is preventable. In fact, 80% of cardiac disease is preventable. And so we have to take charge of our cardiovascular risk factors, meet with your doctors, talk about your personalized risk, and improve care. Thank you.
Thank you so much, Dr. Sharma. Real quick before our next lightning talk, if you have an open seat next to you, could you raise your hand, folks who are standing? If you're looking for a seat, and if you're stimulating cardiovascular, I don't want to get in the way of that, by all means. But there are several open seats. If you're looking for a seat, please don't hesitate. Take a moment, find one. You're not interrupting us at the moment. Would rather you be comfortable. Thank you. All right. On to our next lightning talk. Did I move my page too quickly? For our next lightning talk speaker, Elizabeth Kersey. Elizabeth Kersey is the Vice President of Government and Corporate Affairs for Transurban North America. She leads the company's government affairs, corporate governance, marketing, and communications functions. Please join me in welcoming her to the stage to talk about transportation.
Disappointed that I only got one round of applause to start this, but that's all right. Thank you. Good morning, everyone. Thank you, Drew. For those who don't know about Transurban yet, we are the builders and the operators of the 95, 395, and 495 express lanes right here in Northern Virginia, playing a key role in keeping our region moving. Let me just begin with an overview of what our system looks like. Okay, my gauge for success today was that I got the clicker working and I didn't trip up the steps, so I'm off to a great start. Oh, look at that, another round of applause. So the 95 and 395, as you can see on the map here, the 95 and 395 express lanes stretch from Washington, D.C., all the way to Fredericksburg, and that corridor includes the longest reversible roadway in the United States. For commuters who choose our express lanes for their round-trip travel between Washington, D.C. and Fredericksburg, that choice adds up to saving an average of an hour a day in traffic. The 495 express lanes run from Springfield to just shy of the Maryland border. And speaking of the 495 express lanes, some of you may have joined us back in November when we opened up an additional 2.5 miles of express lanes in the Tysons-Dulles corridor to just shy of the American Legion Bridge. And we're really proud of that project because we brought faster and more reliable trips through one of the nation's busiest corridors. One of the greatest strengths of the express lane system is how deeply interconnected it is with the broader transportation network. You see, at Transurban, we really believe that the region's mobility depends on a comprehensive and holistic approach to transportation. And that includes express lanes and transit and carpooling, biking and pedestrian walkways, multimodal options, all working together. As you know, Northern Virginia doesn't operate in isolation. Our transportation ecosystem is truly regional, supporting the entire DMV region. And as many of us likely experienced on your travels here this morning, this region faces some of the worst congestion in the entire country. In fact, right now, drivers in the DC area lose about 62 hours a year, roughly a week and a half of working time just sitting in traffic. Post-pandemic, transit ridership still hasn't rebounded, and most people continue to drive alone, further straining our roads. Congestion here has again been ranked the worst in the nation, and that a trend is not improving on its own. That's why we must think bigger. To truly unlock mobility and fuel economic growth, We need more than roads and highways. We need robust transit investments, incentives for carpoolers, and convenient multimodal choices that give people real alternatives in our region. Transurban is working hard to meet this challenge head on. The 495 Northern Extension, our most recent project, was designed with every traveler in mind, whether they're using the express lanes, local roads, buses, bikes, or walkways. As part of this project, we established a brand new bus route with Fairfax Connector, linking Tysons and Bethesda. It is now the only direct transit route connecting Fairfax and Montgomery counties. And later this year, new shared use paths in McLean will open, providing safer and more accessible options for pedestrians and cyclists. These additions are about more than commuting. They're about supporting a fully connected, multimodal future. Our commitment goes well beyond building and maintaining roadways. Along the 95 corridor, we have invested over $130 million in public transit through the Northern Virginia Transportation Commission's Commuter Choice Program. These funds have supported new and existing bus routes, improved park and ride lots, and strengthened commuter rail infrastructure, critical components of a balanced transportation system. Carpooling remains one of the most effective tools for reducing congestion. And on all express lanes, vehicles with 3 or more people ride for free. In fact, an entire community has been formed around this phenomenon, known as sluggers and slugging. These commuters meet at neighborhood park and ride lots and share rides to destinations like the Pentagon, saving time and money while reducing traffic on key corridors. These are just some of the ways that Transurban is working to solve our region's transportation issues. Expanding travel choices doesn't just improve congestion, it enhances our quality of life. Fewer cars on the road mean fewer emissions, cleaner air, and healthier waterways. And with less stop-and-go traffic, our roads become safer for everyone. And when communities become more walkable, more connected, and more accessible, local economies benefit. All of this is possible when we diversify and modernize our transportation system. So I'll leave you with a challenge today. I challenge you this week to find an alternate way to work, whether that's taking a bus, sharing a ride, trying a new route. You may be really surprised at how connected our system already is and how much opportunity we have when we continue building a holistic, forward-thinking transportation network. Thank you so much, and I'm looking forward to the panel.
Stay up here.
Oh, stay up here.
Yeah,
Okay,
go ahead.
Can I grab my water? Is that okay?
Please, go ahead.
There's actually water up here. I'll just...
Yeah, there you go. All right, we are going to have a panel discussion now. This is going to be an interactive opportunity for you guys. If you have questions, start thinking of them. We'll bring up our 3 lightning talkers back to the stage. I'm going to join them over here, and we'll walk you through how you can submit a question if you'd like one, and we're going to have a little bit of a deeper dive. Please, sit wherever. So coming up on the screen here, maybe. There it is. 2 options for you. If you want to submit a question for any of the panelists, you can scan the QR, or you can text CF Nova and your message to 22333. So those are your 2 options. Any question you like, and they'll come right to me here on this tablet. But I've got a few to get started while you're thinking of those and submitting those. We'll start, I guess, kind of the same order that you guys presented with housing. We talked about the issues. We know supply. We know affordability. Is there anything that's working? We know that there's been some policy in place when major corporations like Amazon come to town. Hey, we'd love to have you here, but we need help with affordable housing. Are things like that helping, or what else are you seeing in this region that's helping keep affordability mildly manageable?
Yeah, no, I would, and so, we talk about what the challenges are, and I'm really glad that this is the first question because we are actually doing a lot of things right on housing here in Northern Virginia. I think it's important to recognize that. We heard about the role of government in housing, but the fact of the matter is a lot of decisions about how much and what type of housing gets built is in the hands of local government. And our local governments here in Northern Virginia are actually some of the places that other counties and cities around the country look to as examples. And so just very briefly mentioning a couple of things. For example, in Loudoun County with the new metro rail coming in, stations coming in, really thoughtful planning on how to deliver more housing next to transit. Until 3 years ago, Loudoun County, Virginia, Loudoun County, Virginia, did not have a housing department, right? 3 years ago. And so investing in a new department, investing in planning around housing has been critical. In a place like the city of Alexandria, Virginia, there is a very strong public-private partnership where the local government has offered a land free or at reduced cost for the development of affordable and mixed income housing. That has promoted housing and access to transit, to jobs, to services. And then in Northern Virginia, of course, in Arlington, working with Amazon, when Amazon announced their location here in Northern Virginia, really leveraging that public-private partnership to help ensure that housing that is needed to accommodate the workforce, including those supporting the higher wage workers that were coming in with Amazon, was part of the deal. And that was a real success story that other businesses and local governments are looking at.
Great. Moving on to healthcare, as cardiovascular care becomes more personalized and sophisticated, what needs to happen to ensure these advances benefit the broader community?
Absolutely, yeah. I think that we've formed a healthcare system which is catered towards disease management or chronic disease management. So a lot of times people interact with cardiovascular specialists when they've already had a diagnosis.
Rather than preventing it?
Or rather than preventing it.
Right.
Absolutely. So they're already in the hospital. They've had a diagnosis of irregular heart rhythm, or they've had a heart attack and they've had a stent or undergoing surgery. Kind of too late at that point. So I think what needs to happen really is a focus on prevention, because prevention is the best and the easiest form of cure. I'll give you an example. There's a simple test that everybody can think of doing today to understand if they've got the presence of heart artery hardening or blockage in their body. It's called a coronary calcium score. It's a CT scan of the heart. It's not a fancy CT scan. It's kind of like a mammogram, not that squishing part of the mammogram. It's just like a CT scan. It won't hurt you. And so you go in and you basically just get a scan, and it scans you literally in 30 seconds, up and down. And it calculates what's called a calcium score, a simple basic test that lights up heart artery hardening or calcium in your body. And it tells you, it spits out a number and tells you where you are from 0 to 1,000. Lower the better, higher the worse. That test is currently not covered by any insurance provider. Nothing. Nobody covers it. Because we've decided that it's better to pay when the patient's had a heart attack and needs a stent and needs a hospitalization and requires millions of dollars after the event to stay healthy and walking, rather than say, let's see what your risk of having heart disease would be, which would be predicted by this coronary calcium score. So simple things like that, we're really reorganizing healthcare to make prevention the best form of cure is required. The things that people can do right now is to advocate for themselves, go see their doctors and say, what is my personalized risk for heart disease? Everyone can get a personalized risk for heart disease. We have heart disease risk calculators that tell us what is your risk of heart disease in 10 years and 30 years for younger people. Get that personalized risk. It's a calculator, your age, your blood pressure, your glucose, your lipid panel or your cholesterol spits out a calculator which gives you a certain ballpark of where you see. And then it also gives you, if you focus on prevention and control your heart disease risk factors, how will that decrease your risk? Everyone can do that.
Start the conversation.
Yes.
All right, on to transportation. We know that transportation depends on a lot of partners in a lot of different regions. How do they work together? How do I stay in an express lane when I'm going over the Potomac River? How do we all work together? How do we grow that system and improve it working together?
Also, Drew, can you please stop making me go after these two? These are tough acts to follow. Anyway, thank you for that question. I mean, we have a lot of partners, right? And I think one of the biggest challenges we have is a lot of competing interests and priorities from lots of different stakeholders, but a finite amount of time and resources to prioritize what everybody's interests are, right? So one of the things that we work really hard at Transurban and something that's really important to us is that engagement and making sure that we are consistently talking to all of our partners before shovels even go in the ground. And we've done that since the 90s now. And I think if you look at even the 495 Next project that I talked about a couple times in my remarks, that project took a lot of engagement, not just with our state partners, right, as you would imagine, but with the local communities around that corridor. If any of you live in McLean like I do, very active and engaged community, right? And they were very vocal about that, how they felt about that project. And we ask a lot of our communities, right? Before they see the benefit of any of our projects, there's some disruption in their communities, right? And so it's really important for us to get in really early, as I said. And a lot of times, our stakeholders, when they have concerns or questions, it may alter some of our construction plans. We're going to take what they have to say into consideration, and we're going to change some of our planning to address their concerns. And then making sure, to your point earlier, Jay, making sure that we're educating drivers before we open up this 2.5 mile extension. I'll just use that as an example too. I mean, we had not just our state and federal and local stakeholder engagement all throughout the project and leading up to its opening in November, but we had to make sure we were coordinating a lot with the media to make sure that drivers understood what that new corridor was going to look like, because safety is really important to us too. Making sure that we have proper signage and making sure that we're engaging with folks regularly. All of that, I think, big challenges there and some of our toughest challenges, but I think something that we're really dedicated and committed to.
Got a lot of participation. Thank you guys so much. A lot of questions on here. I'm just going to jump right into these because we've got so many. A couple are similar, so forgive me if I kind of merge your question in with another that's like it. We've already heard during your lightning talks about the obvious connections between all three of your sectors, particularly in housing and transportation. Can you talk, I know we talked a little bit about how, especially what we saw in Loudoun, right? When the metro system got out there, we saw a lot of development. What success stories are we seeing in those connections, and where are we going as it relates to generating better, more accessible housing around transportation in those sectors, thinking about it together?
You let me go first?
Please.
Thanks, Drew. So as you said, we do have a lot of overlap. I mean, I think one of the things that I love about this event actually is that we are talking to each other, because there is a lot of overlap in the things that we do. All of us work in critical infrastructure areas, right? And critical infrastructure areas are also really complicated and complex, and they cost a lot of money. And so for us to be talking to each other to figure out where our priorities should lie, where they overlap, I think is really, really important. And for us, I'll use one example. About 1.5 years ago, we opened up a new access point from our express lanes at Opitz Boulevard. And that access point is right there where Centera Health System is at Potomac Mills, which is also really close to one of Virginia's largest and fastest growing housing developments in Woodbridge. And so taking a look at those infrastructure needs and then designing our projects around them has been really important to us, and it's something that we'll continue to do.
Yeah, and talking to this link between housing and transportation, sort of shifting this to transit, because I think that what Northern Virginia has done thoughtfully in a lot of cases is thinking about how to make sure when there are transit stations, particularly metro, making sure that we are planning around those stations. And the Clarendon Boulevard corridor in Arlington County is a national example of how to intensify development appropriately around metro stations. We're seeing now even places where there was development that maybe was lower density, I'm thinking around the Braddock Road metro station in Alexandria, there is a recognition that this is the place to intensify development, to add housing and commercial space, because having access to that transportation is really key. And I mentioned Loudoun County. I mean, it is sort of an unprecedented, sort of once-in-a-lifetime opportunity to develop housing, mixed-use development, housing affordable at all income levels. That's the key, right? And taking advantage of that. The thing I'll add too is it's not just about planning for housing and transportation at the same time, which I think we're understanding, but I think we also, there's a lot of community involvement when it comes to housing planning too, which I'm sure you're not surprised. There's a lot of maybe concerns. Oh, you're going to build more housing in my community. I'm worried about that. I don't know what that means for me. I don't know what that means for my schools. I don't know what that means for traffic in my neighborhood. And I think what we need to do is we need to be planning across those constituents, with the advice of those constituents, but across those disciplines. So if you are planning for new housing, are you also planning for transportation? If you're planning for new housing, are you bringing the schools in to understand the impact on schools and to be very transparent about that with communities? Because you need that community support to make sure that we can have these investments go smoothly. Otherwise, they take, as you know, I'm sure, a long time to get done.
And those are the challenges when you're talking about Braddock Road. There are people already there. There are things already there, right? And that's, when you're extending the Silver Line or the Dulles Greenway, there are some areas out there that are not quite as developed as, and that creates its own set of challenges, as I'm sure you're very aware and working through right now. Back to our healthcare, Dr. Sharma, can you point to compelling and concrete causes as to why women have increased levels of heart disease in this area vis-a-vis men in the region?
Yeah, absolutely. So we have to look at it from a sex-specific lens. There are certain risk factors that occur only in women because of the sex, or the ability to bear children, or just the hormonal changes that happens in a woman's life course throughout the lifetime. There are certain risk factors that accrue during the reproductive time frame. So these are patients who have had infertility, endometriosis, have preterm birth, preeclampsia, which is high blood pressure during pregnancy, which is new onset, or diabetes during pregnancy, which is new onset, or have had multiple abortions or loss of babies. These are what we call as placental syndromes. Just by the factor of biology, cannot happen in men, or can't happen in males. And so what happens with these risk factors is that they are not an isolated moment in a woman's life. They actually have long-term consequences. So preeclampsia increases the risk, or high blood pressure during pregnancy increases the risk of early cardiac disease in women by 3%, three times. So 3 times more likely to have heart failure and 4 times more likely to have heart artery blockages. That's an important distinction. The second distinction that happens across the life course is during the menopause and menopausal years, or transition. Women in perimenopause, usually 44 to 50, and 50 is the average age of menopause in 50 to 51 in the US. And then 51 to 60. This is called a menopause transition, where female hormones that are considered protective for heart disease are rapidly declining. So those risk factors that weren't a problem for women in that time frame start accruing. So a lot of times new diagnosis of high blood pressure happens at the age of 50, new diagnosis of prediabetes, and also changing of the body of the woman. So the fat percentage increases, visceral fat, which is fat around our middle portion of the body and around the stomach and around the spleen increases. And muscle mass decreases. So when that's happening, basically these are the silent dormant years where you haven't really showed up in a full-blown cardiologist's office with a problem, but you're accruing this slowly over a period of time. That in itself, in a nutshell, is like this 20 years of a person's life where they are accruing silent risk factors without actually having full-blown heart disease. So if you look at it from that sex-specific lens, that increases the risk of obesity, which is an epidemic in this country, and is one of the most modifiable risk factors now that we have, and increases the risk of hypertension, which is the most modifiable risk factor. So these risk factors are not something that are quote-unquote genetic. You may have a genetic risk of an X percentage of body weight or X percent of hypertension, but these are all personal risks, and they are modifiable. So if you look at it from that perspective, these sex-specific drivers or markers increase the risk silently over a course of a lifetime.
And can I jump in there too, just to sort of tie it to the housing, because I think about that a lot, is if we build communities where people are more able to walk, right? Where people are able to do their daily activities on foot, where they're able to be out of their car less, maybe because they're able to have a shorter commute because of easier lanes. Like, that has an important impact on people's health, right? And I think that we often don't know how can, sometimes our environment limits the steps we as people can take to help make those choices. And so I think it's really important as we think about housing and transportation, we are also thinking about how much of an impact that can have on the individual choices to take preventative action.
Absolutely. And I have to make a plug for this, right? Because there are certain communities that are disproportionately impacted because of the social drivers of health, these social determinants of drivers of health, right? Which is neighborhood walkability index. We've done studies on that. And if you live in a neighborhood where you can walk, your step count is higher, you tend to have less diabetes, you tend to have less obesity and hypertension. Or food toxicity, able to buy healthy food, access to just general groceries. Or just overall neighborhood safety index. So there are these, what we call as social determinants of health, and based on those, there are very, very deep pockets where health is actually quite bad as compared to those parts in Virginia where the social drivers of health are actually not that bad. And so there's like, these are very deeply intertwined with our basic hypertension, diabetes, because they're so foundational in how people live, where people live, how they live. Their access to food, access to healthcare, access to education, access to jobs. Those make a very big impact in your ability to prevent and heart disease and promote health.
And I think to both of your points, communities are asking for these things, right? So every time we go and we're working on a project across a community, they're demanding these shared use paths and widening of sidewalks. And if we're going to rehabilitate bridges, widen them and put pedestrian and bike pathways on them. I think communities are really invested in this as well. And I think us making that a priority and building those types of things into our projects is really, really important. And it goes back to that where I started around community engagement, making sure that we really do have our finger on the pulse of what these communities are asking for because we're engaging with them and addressing the concerns, and because they really are asking for these things.
That leads right into a question that we've got from the audience. Transportation, healthcare, and housing, as you each shared, are potential barriers to economic mobility for the young adults in Northern Virginia. So how do we build partnerships with our region's biggest employers to offer holistic and wraparound support to open doors, enable economic mobility for our next generation of workers? I get, and how much of that is maybe on the private sector? How much, like in Transurbans? Is it common practice for Transurban to work with private developers or the business sector versus the government? Are they talking with the private sector in terms of what their need is?
It's all of the above. I think as we've been talking about, it's really important if we really do believe, and I love the express lanes, right? I use them as much as I can. Hope all of you do too. But that's not the solution to our traffic and infrastructure issues in Northern Virginia. It's just not, right? And so we really do need to take this holistic approach, keeping all of these sectors in mind, young adults and older and running the whole gamut to say what does this community need and what does the private sector need? I used that Opitz Boulevard example, but which I think is a really good one. But even through our Project Next, the 2.5-mile extension on 495, it was the same engagement. It was with the private sector, and where do we put on-ramps and off-ramps, and where do we make sure that we're building in this holistic view, the Fairfax Connector additional bus route that I mentioned, that is the only direct route now between Virginia and Maryland across that corridor. Being able to get off the metro with your bike and bike to someplace over in Tyson's, right, so that you don't have to worry about driving your car every day. I mean, I think making sure that, we're talking to our local, state, and federal partners a lot, but we also engage with the private sector to know what do your employees need and communities, what do your residents need, so we've got this holistic view of the infrastructure needs in terms of transportation.
And so this is the room, like I've said this kind of thing a lot, but this is the room to say it in. So I think people often say, oh, we need to engage the business community on housing, right? That's sort of a buzzword. And the fact of the matter is the business community, whether it's Amazon or Inova or whether it's Google or Microsoft or George Mason University, like they are not in the business of building housing. They're just simply not. But there are people in this room that understand the business of housing and getting to the keynote about connecting the people, the consultants who can do the work, right? As long as you have the buy-in from the private sector. And when they understand, as Amazon did, the important role that housing plays in workforce retention and attraction, right? It becomes more like about their bottom line in addition to their philanthropic like sentiment towards the region. So my sort of perspective on how to engage with the business community around housing and really all of these issues is keeping in mind that that is not their business, right? And so sometimes for folks in philanthropy or in housing or health or transportation, you have to talk to them about what you need, right? And I think that that's sometimes where we miss the boat. We're like, we want to engage the business community, and they may be interested, but they need to work in partnership with the folks who know how to do the job on the ground. And I think we could do more of that. And I think we could learn from what we experienced with Amazon, that there's a whole organization within Amazon designed around partnering with nonprofit developers to build and preserve affordable housing in Arlington and in other places. And I think that can be as a model, right? And I think that it's this idea of telling the story about why housing matters, maybe not from the one perspective housing folks have maybe thought about, but rather broadening the conversation to talk about the broad range of impacts housing has on the community, to draw in those partnerships, I guess.
Where does healthcare fit into that conversation? I mean, is it simply access to being able to get to a clinic a little bit more accessibly, that I don't have to take a bus, take a train, rent a car and do all that if I don't have that mode of transportation myself? Yeah,
absolutely. I think it's that, and also testing sort of care models or care delivery models, right? That are
what
more
is that?
So care deliveries, how does care get delivered to you? How does healthcare get delivered to you? You got to get up, drive your car, go to a clinic, park there, pay for parking, then, take the whatever escalator, elevators, wait in a clinic, wait for your doctor who, like me and many others, is probably seeing 15, 16, 17, 20 patients a day, and then spend their 15 minutes of time with your doctor, who's going to say, oh, everything's great or everything's not great. And gives you a plan, and then you go by your way, and then you're scratching your head and like, well, what, I have to see 10 other specialists now? Like, I have all this going on. So if you look at it from the perspective of a patient, they're just like, oh my God, I went to see this person, now they've told me to see 5 more people. And so that is a very, very clunky, very difficult, very fragmented way of practice, but that is really the care model most places. We are lucky in Northern Virginia that kind of care model actually exists. If you're really talking about central Appalachia or other parts of Virginia, that may not even be an option. Just to give you an example, in certain parts of rural America, a woman has to travel about 60 plus miles to see an OBGYN for delivering a baby. This is the US, 60 miles. in labor. So the way we have decided to, it's insane, right? So and so the care model is such that we pay for that kind of care. This is the kind of care we pay for. So how about we flip that conversation and say we're going to design and test innovative care models that are integrated. So how about if you have existing heart disease, we create a care model where you can see your doctor in a way that you have a doctor and a clinical pharmacist at the same time, or you're a doctor and a clinical pharmacist and geneticist at the same time. Or in my specialty, in Inova, you have, if you're a high-risk patient who is wanting to deliver with heart disease, you're seeing maternal fetal medicine, you're seeing cardiology and pediatrics or genetics at the same time. So you have combined 5 different opportunities for the patient to actually deliver care at a one-spot stop. You get your labs the same day, you get your EKG the same day, you get a fetal ultrasound the same day, and you have the whole 5 different appointments into one. We haven't really tested that for payment or how it's being reimbursed or how CMS will pay for this. Similarly, I talk a lot about prevention. Nutrition, dietary services are almost never covered by an insurance plan. And exercise and exercise therapy is almost never covered. So the patient has to pay out of pocket. You go see your doctor, get an exercise prescription, then pay out of pocket. So we really have to prioritize caring for patients in a delivery model that's really different. They are starting to do that. There is this new movement, Make America Healthy Again, in good ways or bad ways. You have to look at it from the perspective of, is it going to allow us to test these care models compared to usual care for patient outcomes, patient-centered outcomes, what patients value, not death and morbidity and hypertension, because in a middle-aged person like me, death hopefully is not, going to be like 20 years from now. So that's not a really outcome. Outcome is, did I make all my appointments? How do I feel safe and connected? Did I feel cared for? Did my immediate blood pressure improve? Those kind of outcomes are different, and healthcare doesn't pay for those outcomes. It's a long talk, but I think what we really have to think about is caring and designing patient-centered outcomes for immediate relief, right? Because that's what we're focused on in some ways, and also testing these integrated care delivery models where you have multiple specialists at the same time.
Is there a financial benefit to the institutions that we're asking to build those things versus the way we've been doing it?
Probably. It's also a staffing issue, right? Like, you've got to pay the staff. If I combine 10 different visits into one, then I only need one person at the help desk. I need one nurse, and that's it. But when you have so many overheads, so many different places where healthcare can be reimbursed, it's a real disincentive for institutions to say, well, why does Dr. Sharma want 5 different clinics combined into one where we can have 5 different clinics?
Right.
So it's,
It actually makes me wonder too. I was talking to my dad the other day, and he's like, he's on a Medicare. He's not working, but I was thinking about like this idea. He gets credit from his employer, let's say, for doing things that are preventative. So you asked about what can businesses do, and it made me wonder if there's an opportunity to incentivize a business to make it easier for us to do the things that we know we need to do. Or let's think about the other things. Like, let's say a business thinks about how to make that commute easier, and maybe it's childcare on site, right? To help with that, having to, trip chaining, have you guys heard that? You have to chain trips together to do things. Or on the housing front, I know a lot of companies in Northern Virginia have explored down payment assistance programs. So I think to these issues, I think your question about how businesses can help, I think it's understanding this challenge that workers in the region face and thinking about how can businesses help be part of the solution to help retain the most educated, talented workforce that we have here in Northern Virginia.
Got a couple questions about technology. Forgive me for maybe looping a couple of things that aren't exactly similar. There were a little bit about AI and also some questions about EV and autonomous vehicles. Let's, I guess, start there. What's the timeline and vision for integrating emergency mobility options EV autonomous vehicles into the regional infrastructure?
Yep, it's something that that we've thought a lot about at Transurban. In fact, our roads are already smart roads. They have about 20,000 data points in each of our roads, and so they can tell us a lot about what's going on. And in fact, we've done this really cool partnership with Virginia Tech where they brought their autonomous vehicle and we put it on our 495. We closed that section of the road while that testing was going on. But what was really cool was that their smart vehicle was on our smart road, and it told us a ton about where the vehicle could communicate with the road, right? So we had the vehicle go around some debris. We had it conduct a test where there was bad weather, all kinds of different tests, and it was really cool. And it has really made us think about kind of what the future of. I don't think I think we're doing a lot more in other countries. I think they're ahead of us on the autonomous vehicle front, especially when it comes to freight. I don't think we're ready for that here, but I think the fact that we're doing these tests and we're looking at that, I think is some really exciting work that we're doing, and that we'll continue to do.
And like that sounds fine if I'm taking an autonomous vehicle from like the West Falls Church Metro to Reston Wheelie Metro, but what about down to Main Street? Like is that so far out in the future, or is the research that's being done now on closed off sections of 495? Is that not terribly far off from getting into towns and neighborhoods?
I think we are thinking about that when we're conducting these different tests. We're thinking about all of that. We're going to continue to do that. I think a big piece of it too is if you look at things like Waymo and different innovations like that. A lot of people are nervous to do that, right? Like they're not.
Sure.
They don't want to get into a cab that is driverless, right? But I think, so I think a big piece of it too is educating the populace around, the safety features of that and making them feel like they can take advantage of that kind of technology and they can do it safely and efficiently.
Healthcare and housing, artificial intelligence, are the industries integrating this? I'm sure that you are. What's the impact? And everybody was, a few years ago, oh my God, AI is going to take our jobs. And then we've been hearing, well, it's creating new jobs, it's creating different jobs. Somebody's got to be helping that. Where are you seeing that in your fields? And what does that mean, for those of us who aren't working there but are utilizing that?
Yeah.
No, please.
Yeah, so I mean, AI is I look at it as an innovation to provide help to the clinicians and to the physicians and to healthcare. So it augments healthcare in many ways. AI is not going to replace our jobs to a large extent, but AI will replace the jobs of physicians and healthcare systems and people that don't know how to use it well, right? So for example, on a day-to-day basis, where do I see the biggest benefit? In using electronic health records, where the AI can generate a patient's risk, and it pops up in the chart. You open the chart, AI tells you in the electronic healthcare record pop-up saying, based on this, this is the patient's risk, have this conversation. That is helpful. AI software that is installed in our CICUs, which is the critical care units, that is able to predict the risk of having a certain outcome in the hospital, that can alert teams, put in this place for antibiotics, put in the place for management of blood transfusion, make sure the urinary output is checked. Simple things like that the human mind or eye can miss, that AI can help detect it. AI can help detect masses and nodules and little things in our breast mammograms now that tells us that there is an increased risk of heart disease. So things like that is very helpful in the very day-to-day patient-related things. AI technology in transcribing patient notes. So there's what is called ambient AI is in the room.
Yeah.
works on the intelligence that it gathers and is transcribing a patient-doctor conversation in the patient's chart that can spit out the details of that conversation in very, very good scientific terms, and then translate that into patient terms that the patient actually then gets an output on their visit out when they take it with them or it's in their chart. Those things are usually helpful because you can imagine if you're seeing 20 patients a day, one of the things why we're losing healthcare professionals is the burden of the job that is their burnout. Yeah. Because there's what we call pajama time, where your doctor sees you or your clinician sees you, and then they go home, and then they have 25 charts and about 50 patient calls to take. There's no time. So they do it at home from like 8 o'clock to 11 o'clock at night. And so AI can help with things like that, which will reduce and shrink that time to increase efficiency.
Here's a question, though, and I hear all that and I appreciate that. What I wonder is, as a layperson that I don't know, is that when you're looking at risk factors, just to, from something you just said, I do not believe that a data center in Ashburn cares about the outcome there. I believe that you and your colleagues have that, you care if that gets wrong, if there's a mistake that's made. Yeah. Why should I have confidence, as a patient that some of that AI is going to look at it through a lens of, this is a human being and the outcomes are much different than they are for a server.
Yeah, and you're right, because AI is only going to be as good as it's programmed, and so it's going to miss certain the human elements of it as well. So that's why I think, it should not replace.
Sure.
It should not, and it's not done with the intention of replacing the very bedside clinical practice. But there are ways to incorporate it intelligently in the system where it can be validated. You have to validate technologies that test them for effectiveness, you test them for validation, you have to, before they're introduced into the normal workforce or care plans, they have to be vetted out very significantly to make an impact.
Yeah, it's on the housing front. You see these charts that show what jobs are at greatest risk of displacement from AI, and a lot of the jobs that we rely on to build housing are in the least risk of being replaced by a category. You need carpenters, you need welders, you need electricians, and those are the jobs, to be honest, that I don't think that we in Northern Virginia maybe has invested in as much as we need to. Our construction labor is very limited. Going into the trades, my son went to Alexandria High School, 9th grade, he walks through the door, the first thing he gets is a packet on how to make sure you're ready for a 4-year college. It wasn't, hey, maybe the trades are where you need to go, or maybe you want to start a business, or maybe you want to go in the military. So focusing on the trades is going to be really important. But where I see opportunities for AI is sort of what you were talking about, is in the affordable housing space, there is a lot of regulatory burden on nonprofit developers who are using public funding to build affordable housing. You could imagine AI would help streamline some of that reporting process, some of that burden that is associated with reporting. There may be ways to use AI to understand how to measure trade-offs from reducing certain levels of regulation. What do you get in terms of housing production, and what are the trade-offs in terms of other pros and cons of those types of changes? But when it comes to labor, I don't see AI having a big impact, at least right now, on the number of workers we need in that sector.
All right, we've got about 3 minutes left for this first half of our session today. I want to tie it back to the idea of private philanthropy that we were discussing earlier. Where would the panelists put or ask for funding for their relative area, housing, transportation, or health, to help us remain proud in 2036? Maybe ask to finish, I had a DAF, I'd set a recurring donation to blank.
I can start. I think that on the housing side, I think there's a couple ways. One thing is, if you are a business and you have land that you can help make available for housing, that is critical. Land accounts for 35% of the cost of delivering housing, and if you can make that land available to a nonprofit developer to build housing, that could have a humongous impact. But and what I'll also say is, if you are a business and you care about housing, if there is housing planned for your community, make it known to the local elected officials that have attracted you to their local community that you think it's important that they approve that. Now, that's not funding, right? But I think those are the things that, that businesses can do in addition to supporting the very well-qualified, very mission-orientated folks delivering housing in Northern Virginia.
I think the recurrent donation should be towards focusing on testing care plans or care delivery plans. There are a lot of services that are wraparound services in the care of patients that unfortunately or fortunately are not paid for and not reimbursed, and because of that, those professionals can't be hired or they're hired per dime. So you have to focus on, like, whether it's nutrition, whether it's wellness, whether it's facilities that are tied into a hospital or healthcare system where it increases access to patients to healthy lifestyle and healthy prevention. I think that would be a wonderful time, way of spending time. The also area that gets impacted quite a bit is research, right? So before we go to a payer and say, pay for this drug or pay for this test, we have to do clinical trials. We have to do randomized clinical trials. In nutrition, in wellness, in exercise, in home blood pressure monitoring, in making sure that we have, patients get, 5 different clinicians at the same time. It's very hard to do randomized controlled trials because industry does not pay for those kind of trials. If I was testing a novel drug that costs millions of dollars to make, I would get industry funding. So that's where private philanthropic support makes a very big difference in testing procedures, trials, designs that are not paid for by NIH or by Heart Association or by industry.
Private charity and transportation, where's that asked?
I love what Lisa said about connecting with your elected officials. I know that's not directly philanthropic, but I do think it's really, really important. And as we're working through this holistic, we've talked a lot today, at least I've talked a lot today about this holistic vision for transportation. I think engaging with elected officials is really important on what that looks like to you. And then just to flip your question a little bit, we have a community grant program at Transurban that we're enormously proud of. Virginia Bolger, my team, is here and she administrates that program. If you have an organization or a part of an organization that you think we should look at in terms of funding, I would love to hear from you, and I know Virginia would too. So please communicate with us and let us know if you have good ideas around things that we can help support in our community.
Thank you so much. From the lightning talks to this panel discussion. Let's give it up for our 3 panelists. This is fantastic.